What is a health education specialist? The health education profession is responsible for assuring quality and professional preparation and practice. Responsibilities and competencies of a health education specialist. The skills needed to practice health education and promotion are clearly delineated as responsibilities, competencies, and subcompetencies. The 7 areas of responsibility essentially specify the overall scope of practice for health education specialists. They provide the general idea of what health education specialists do. Under each responsibility, there are 4 to 7 competencies. A competency reflects the ability of the student to understand. The first area of responsibility involves assessing needs, assets, and the capacity for health education and promotion. This responsibility provides the foundation for program planning and planning the assessment process. Access existing information and collect data related to health. By identifying sources of data, critiquing health information, and identifying gaps using theory and evidence, collaborative relationships and agreements are created to facilitate and access collection of data. Identify and analyze relationships that influence health, such as behavioral, environmental, and genetic factors. Examine factors that influence the learning process and the process of health education. Determine available health education programs, interventions, and policies, and assess the quality of available programs. Identify potential partners and assess social, environmental, and political conditions. Infer needs for health education based on assessment findings. Analyze assessment findings, identify and prioritize emerging health education needs, and report findings. Area of responsibility 2. Plan health education. Identify and involve priority populations and other stakeholders by eliciting their input to develop collaborative efforts and obtain commitments. Develop goals and objectives and design strategies and interventions. Utilizing needs assessments identifies desired outcomes by designing theory-based strategies and interventions. Assess resources needed and comply with legal and ethical principles. Develop a scope and sequence for the delivery of health education and factors that affect implementation. Develop a conducive learning environment, use logic models and resources to guide the planning process. Responsibility 3. Implement health education. Collect baseline data to assess readiness, implement a plan of action, and use a variety of strategies to promote and deliver the plan. Promote the plan, and then launch it into action. Monitor implementations and train individuals involved. Modify plan of action as needed. Demonstrate a wide range of training strategies to deliver the training and select participants. Responsibility 4. Conduct evaluation and research related to health education. Design instruments to collect and analyze evaluation data. Interpret results and apply findings. Responsibility 5. Administer and manage health education. Explain how program goals align with organizational structure and mission. Obtain acceptance and support and provide support for individuals who provide professional development opportunities. Manage human resources and facilitate partnership and support of health education. Develop volunteer opportunities and recruit and evaluate volunteers and staff. Apply appropriate methods for team development and model professional practice and ethical behavior. Responsibility 6. Serve as a health education resource person. Assess information needs and identify valid information that is accurate, relevant, and timely. Convey and disseminate health-related information to priority populations and key stakeholders. Serve as a health education consultant and provide training. Responsibility 7. Communicate and advocate for health and health education. Assess and prioritize health education and advocacy needs. Identify accurate, current, and emerging issues that may influence health. Analyze factors that influence decision-making and impacting existing proposed health policies. Identify and develop a variety of communication strategies, methods, and techniques. Create tailored messages incorporating images to enhance messages, using communication theories, models, and targeted towards priority populations. Engage in health education and advocacy and influence policy to promote health and health education professions. Develop an advocacy plan in compliance with policies. Communicate the impact of health education on organizations. Develop a plan for growth and service as an advocate and mentor for health-related policies to influence decision makers. Summary of responsibilities. The responsibilities, competencies, and subcompetencies required for health education specialists do not function independently. They are highly interrelated. All of the responsibilities demand excellent communication skills. Conducting an accurate needs assessment requires research skills to identify and gather appropriate resources. Planning should be based on valid and reliable needs assessment. When implementing programs, be prepared to serve as a resource person when asked. Evaluation relies on goals and objectives established during the planning process. Coordinate people and administering programs are necessary in planning, implementing, and evaluating programs.